Good morning. Thank you for considering this proposal. I am Kenya Holmes Preston from Liberty University, and today I'll outline my proposed research project on how mental health programs can lower recidivism rates among offenders. In this presentation, I will summarize my research project proposal, its alignment with Liberty's mission, and how it fits a selected grant to seek your funding support. The cases of mental problems are high among imprisoned people, as a great number of criminals are victims of such mental conditions such as depression, anxiety, and substance use disorder. It is estimated that 44% of jail inmates and 37% of the federal and state prisoners have mental illness, in comparison to the 18% of the entire population. The study proceeds to show that within a period of 5 years, the rate of mental illness among incarcerated people rose by 11%. This includes depression, anxiety, post-traumatic stress disorder, and substance use disorders, which are found to increase the risk of committing a crime. Untreated, these lead to repeated offenses, leading to higher recidivism. Research by Dalbert indicates that psychiatric disorders are not only prevalent, but are also some of the factors leading to recidivism because untreated disorders worsen criminal behaviors like aggression, impulsivity, and drug abuse. Specifically, the risk of violence or aggressive action by offenders who have untreated post-traumatic stress disorder, anxiety, and depression increases and makes them further involved in the criminal justice system. Such findings provide the need to focus on the management of mental health problems in correctional centers using effective mental health treatment programs. Different studies have revealed that mental health treatment programs in prison can contribute to diminishing recidivism to a great extent. One of the widely applied and proven effective interventions is cognitive behavioral therapy, or CBT. This is effective in solving such issues like anger management, impulsivity, and criminal thinking patterns, which is common among offenders. The research conducted by Miller in 2022 revealed that CBT is an effective intervention that can practically decrease recidivism because it can be used to make a maladaptive behavior by the individual become apparent and be replaced with more adaptive behaviors. In a similar manner, medication assisted treatment, MAT, has also been effective in decreasing recidivism in patients with substance use disorders, as this allows them to cope with the symptoms of withdrawal, cravings, and long-term recovery. Although mental health initiatives have potential in minimizing recidivism, there are a number of obstacles that limit their success. The first problem is the lack of qualified mental health practitioners in the prison facilities, thus reducing the capacity to offer quality health services to the offenders. Also, prisons are often poorly equipped, lack resources such as funding, and are congested, further worsening the successful execution of treatment programs. In addition, mental health stigma may lead to the refusal of help by offenders in correctional facilities. This stigma not only affects the readiness of offenders to engage in mental health services, but it also affects the orientation of the correctional personnel, who might not take mental health care as a component of rehabilitation efforts. To overcome these obstacles, it is necessary to deal with the institutional limitations and the cultural orientations towards mental health within prisons. This research aims to assess the efficacy of various mental health programs in preventing recidivism in offenders. It will examine what contributes to the success or failure of these programs, such as the intensity of mental health disorders, the form of treatment, and the support provided. The given study will be based on the risk-need responsivity, R&R model. This implies that the successful rehabilitation programs should be focused on the criminogenic needs of offenders, including mental health problems, and should also address the risk level of the offender. The issue that the study will solve is the lack of empirical research on the effectiveness of mental health treatment programs in reducing recidivism rates among offenders, especially those who have complicated mental health histories. Through a mixed methodology, this research will make an important contribution to the literature on the most effective therapeutic interventions policymakers can advocate for harnessing rehabilitation and preventing recidivism. The main assumption of this study is that recidivism rates among offenders will greatly decrease due to their involvement in mental health programs. The independent variable is the nature of the mental health program that entails CBT, substance abuse counseling, and medication assisted treatment. Recidivism is the dependent variable, which is the rearrest or reincarceration within 5 years. The control variable will consist of age, gender, previous criminal history, and the intensity of mental health disorders. The researcher will employ a mixed methods design. The quantitative part will entail a review of recidivism rates in the participants within a time span of 5 years. Criminal justice records will be used in tracking recidivism, and statistical analysis shall be done to establish the impact of mental health treatment on recidivism. The qualitative part will involve semi-structured interviews with the offenders, mental health workers, and correctional officials. The research will encompass 50 subjects, of whom 30 will be inmates in the correctional facilities that have developed mental health treatment initiatives. 12 will be mental health workers, and 8 will be correctional officials. The criteria to choose the participants will include a history of diagnosed mental health disorders, a desire to take part, and at least 6 months of incarceration. Participants will be randomly allocated to various treatment groups, which will include those treated with CBT and substance abuse counseling, as well as those treated with medication-assisted treatment. The standardized measures to be employed in the study will include Beck Depression Inventory, that's BDI, and the Addiction Severity Index, that's ASI, which will be used to determine the severity of mental health conditions prior to and after treatment. These instruments are proven in past studies and are regularly applicable in clinical practice. Data on recidivism will be gathered using the official criminal justice records and will cover such items as rearrest and reincarceration. Recidivism as the rearrest or reincarceration within the research period will be the main indicator of success. Secondary measures will involve the change in mental health systems, where the BDI and the ASI measures will be used. Interviews will give qualitative information on the personal experience of the subjects who were involved in the mental health programs and how the programs affected them in their rehabilitation and integration into society. At Liberty, our mission is to train like champions for Christ who make real-world impacts. This project embodies that by using forensic psychology to aid vulnerable populations, reflecting stewardship and the Great Commission through compassionate, evidence-driven reform in the judicial system. It aligns with our commitment to service, stewardship, and a biblical worldview of restoration. I've carefully selected the Bureau of Justice Assistance BGA FY25 Public Safety and Mental Health Initiative as the ideal funding source for this project. This competitive grant recently posted in February of 2026 with applications due by late March. This allocates up to $42 million total, awarding up to $3 million per project over 36 months to support state, local, or tribal initiatives that implement comprehensive reentry strategies. The program's core goal is to boost successful community reintegration for adults exiting incarceration or supervision while directly reducing recidivism through targeted interventions. What makes my proposal a strong match? The solicitation explicitly prioritizes evidence-based interventions that address key reentry needs, including behavioral health and mental health treatment, precisely what my study evaluates. It calls for strategies grounded in validated risk assessments, which mirror my use of the risk-need responsivity R&R model, to focus on criminogenic factors like untreated mental health disorders. My mixed method approach tracking 5 years of recidivism rates quantitatively while capturing live experiences qualitatively. This will deliver the rigorous data and recidivism indications or indicators reporting that the grant requires, including partnerships with correctional facilities and practitioners. This isn't just a fit, it's a strategic opportunity to generate actionable, scalable evidence that can help jurisdictions expand effective mental health programs nationwide. Funding this research will not only advocate forensic psychology, but also support BGA's mission to reduce recidivism through innovative, collaborative, and data-driven reentry programs. I'm confident that this alignment positions the project for success in the competitive review process. In conclusion, this research proposal explains a research study that will examine the efficacy of mental health programs in curbing recidivism among offenders. The research findings of this project will be useful in creating valuable information on how forensic psychology can enhance rehabilitation activities within the criminal justice system. This study can inform policy decisions regarding criminal justice reform and the rehabilitation of offenders when it examines the effectiveness of various mental health treatment programs. Moreover, the paper will indicate the critical nature of implementing solutions to mental health challenges as a component of an overall program to control recidivism and enhance the outcomes in the judicial system. By funding it, you will support research that saves lives and resources. Thank you for your time, and I really do hope that you enjoyed my research proposal.